Hi, good morning. My name is Bonnie Abibi. I'm going to be doing an educational activity on the intra-aortic balloon pump. So let's get started. All right, so our anticipated learners for this activity are going to be ICU nurses as well as interventional radiology nurses. Primarily, this presentation would include new hires, novice nurses, and then it's highly encouraged that even experienced nurses continue to take educational classes, including ones like these, just to brush up on some of the techniques, maybe newer methods that might have rolled out. So the purpose of this presentation is to allow learners to successfully implement a plan of care for patients receiving intra-aortic balloon pump therapy, including demonstration of the equipment and use. Some of the benefits and indications of the intra-aortic balloon pump therapy. This is a device that sits in the descending aorta. It's an actual helium-filled balloon that inflates, allowing increased coronary oxygen perfusion during diastole. Some of the indications of this type of treatment include cardiogenic shock, left ventricular failure, severe unstable angina. It's often used as a bridge to cardiac surgery or bypass surgery. We'll see this used with an acute or impending MI, myocardial infarction, or somebody who's struggling with an MI who goes into like pulmonary edema. The cognitive domain is what we're going to focus on. It supports an emphasis on knowledge, includes recall and recognition of specific facts, procedural patterns, and concepts. With that being said, the intra-aortic balloon pump is a complex device, so having kind of like a procedural pattern to follow is only going to help learners become more efficient with caring for these type of patients. All right, so our objective is going to be, upon completing this presentation, learners will be able to demonstrate proper management of intra-aortic balloon pump equipment and be able to describe at least 6 potential complications with the intra-aortic balloon pump. The learning strategy that I had selected was a case study, just because I feel like unfolding case studies can increase a learner's critical thinking skills and problem-solving skills while also improving their motivation to learn. It gives you a chance to analyze real-world examples, which can help develop higher-level reasoning skills. A case study often compels students and learners to analyze and discuss these complex situations among their peers. So we're going to do an unfolding case study with visual cues, and we could even do focus questions to help guide group discussion. The learning application is going to be there are multiple reasons to use and avoid an intra-aortic balloon pump, and critical care nurses have to understand how to monitor these patients and operate the balloon pump. Knowing when to intervene is crucial, and anticipating complications in these patients. All right, so let's get started. I'm going to present a case. This is going to be Alice. She is a 52-year-old female who presents to her local emergency room with epigastric and back pain. Sometimes women present with atypical signs of myocardial infarctions. So, and 12-lead EKG is obtained. It's showing some ST elevation in her anteroseptal leads, specifically V1 to V4. A STEMI is flagged on this patient. Her only medical history is hypertension, high cholesterol, and poorly controlled diabetes. So a lot of those risk factors for a heart attack. So she is taken to the interventional radiology department. A stent is placed in her LAD, her left anterior descending artery. However, during that procedure, it's noted that she's got multiple other vessels that are occluded. And it's discussed with her after the procedure that she's going to need bypass surgery. The decision was made to insert an intra-aortic balloon pump just to help bridge to get her to bypass surgery. So she arrives to the ICU, the balloon pump's in place. The primary nurse is going to receive handoff from the interventional radiology team. And this is kind of where we jump in and start assessing our patient. Let's look at the monitor and let's review the pump. And most importantly, let's take a look at our patient and see what's really going on with her. So on the right-hand side, you'll see a picture of the balloon pump. Now, hanging on that little IV pole is going to be your pressure bag with your transducer. That transducer, when your patient comes up, you want to make sure that that is at their phlebostatic access. So that's going to be fourth intercostal space, mid-axillary line. You want to make sure the bag is inflated and it's at your 350 millimeters of mercury. So we use these often for arterial lines. This should be a familiar type of setup for these nurses. So the approach is going to be a femoral arterial insertion site. So you've got your introducer going into your femoral artery. Most importantly, we're going to be checking the groin site, making sure there's no bleeding, no hematomas. You've got good CMS integrity in your leg. You've got good pulses, good distal pulses. Your pedals are intact. And then kind of the bottom picture is going to be your intra-aortic balloon pump. You're going to be able to look at your monitor and truly see what's going on, the timing of the pump, and look at your various waveforms. Alice's immediate nursing goal is to anticipate, identify, and manage any kind of deterioration in her condition. Those are her expectations of us. So, first thing we want to do is perform a complex assessment of this patient. We're going to listen to her heart sounds. We're going to listen to her lung sounds, especially if she was having any kind of pulmonary edema. We want to be able to clearly auscultate what's going on. So the best thing that you can do is place the balloon pump in standby mode to clearly be able to auscultate heart sounds, lung sounds. These type of patients are obviously going to be in the ICU, so these Q1 hour checks are crucial. Like I was saying earlier, we're going to check that femoral puncture site for any kind of bleeding or hematoma development. If you do see any of signs of bleeding, you've got to notify your charge nurse, your cardiologist, or your intensivist who's going to be managing these patients. The best intervention that we can do as nurses at the bedside is hold pressure and kind of wait for everybody to respond. But using your chain of command to get people into the room, as this can be definitely more of an emergent type situation. You're also going to be checking bilateral radial and pedal pulses, as well as just your CMS, your integrity. Is the hand nice and warm? Does she have good cap refill? Are you able to palpate the pulses? Is the foot all of a sudden cool, cold, and you're not able to palpate pulses? We are also going to be checking urine output. So these patients are on strict bed rest. They cannot get up. So we're going to be looking for her urine output. They'll have a Foley in place, so we're going to be looking for their urine output. Is it going from 150 an hour down to 20 an hour, or are we totally anuric and not producing any kind of urine? Another additional assessment is we're going to be looking in that introducer sheath to see if there's any kind of flecks of blood. Often that'll look like betadine flecks within that tubing. After we do a thorough complex assessment of our patient, we're going to move on to the monitor and take a look at the intra-aortic balloon pump console. We're going to look at timing. We're going to look at our augmentation, different waveforms, different pressures that the patient's producing, as well as the machine producing. And the machine should be set up to print you a waveform every 2 hours, but we'll walk you through how to do that as well. Okay, so to meet our objective of this presentation, we need to understand those complications. Some of these more crucial complications are going to include early and late inflation. If the inflation is too early, the balloon is going to inflate before the aortic valve closes. So this is going to pump blood backward into the left ventricle, increasing your afterload, increasing the work that your heart has to do. Late inflation will lead to suboptimal coronary perfusion. So it's just not effective if your timing is off. All these devices now are automatically timed to inflate based on your QRS. So rarely are we seeing any kind of inflation timing issues, but it's really crucial to know what you're looking for as far as timing. And like Ed mentioned earlier, the blood in the tubing. So it's going to look like betadine flex. This is definitely emergency situation too. You're going to notify your charge nurse, your intensivist, and your cardiologist. We're obviously concerned about any kind of hemorrhaging internally, so really important to pay attention and do an hourly assessment. I'm noting that these patients are on anticoagulants and higher risk of bleeding. So blood in the tubing, bleeding at insertion site, loss of pulse in the distal extremity. So the sheath is going in through your femoral artery. If that possibly can get occluded, you're going to have a loss of sensation, loss of pulse, a cool foot in that distal extremity. So really keeping a close eye on that. If you're noticing pulses are 2+ and all of a sudden you've got a cool, very weak, barely Dopplerable pulse on that right foot, that's definitely an emergency. Tachyarrhythmias, we want to just really kind of control those arrhythmias with any kind of medications. And then loss of pulse in the left hand or decreased urine output. So the pump, like we had mentioned earlier, is sitting in your descending aorta. If it migrates up, it can occlude your subclavian artery. Your subclavian artery feeds into your left hand. So if that's occluding your subclavian, you're going to have a loss of pulse or a decreased color sensation in that left hand. Best thing that we can do for these patients as far as that kind of complication is put their SpO2 monitor on their left hand, specifically the thumb, because it's going to feed, that subclavian is just feeding blood to that left hand. If you put your SpO2 monitor on that left hand, you'll notice changes pretty quickly in the waveform on your pulse ox monitor. Same thing with decreased urine output. If the balloon does migrate below, it's going to impede or block the blood flow to your renal arteries, which is going to lead to a lack of urine production. So all these are some of the main complications that you'll notice with an intra-aortic balloon pump. Thankfully, Alice didn't have to have any of these complications. She was able to successfully bridge to a bypass surgery and is doing well. So thank you so much.